Biochemistry, ATCOM modules 1.1 enumerate and describe the role of physician in healthcare system and describe the commitment to lifelong learning as important part of physicians' growth. According to new CBME guidelines, Module 1 of ATCOM fixed with anatomy, physiology, and biochemistry, Module 1.5 and 1.1 in anatomy, and 1.2, 1.3, and 1.4 in physiology. Today's our speaker is Dr. Sufia Naseem. She is an assistant professor in Department of Biochemistry, Jawaharlal Medical College, AMU, Aligarh. She has also done advanced course in medical education from NHL Ahmedabad. She has also done fellowship in genetics. Dr. Sufia is an active member of medical education unit in AMU, Aligarh. She is involved in proper implementation of CBME in AMU Aligarh. Dr. Sufia is also resource person of BCME. She is also resource person in many workshops and CMEs organized at national and international level. So please, all of you, please welcome Dr. Sufia Naseem.
Am I
Over
on?
to Dr. Sufia.
Thank you, Anita ma'am. That was too generous of you. Hello, everyone. So today we will discuss about ATCOM, and especially in biochemical perspective. We all know that ATCOM has been incorporated into the curriculum since 2019. Before this, it was a hidden curriculum. So I'll start with my presentation. Is it visible? एक minute.
Yes, Sufia ma'am, it is visible. Thank you.
Okay. All right, just give me a minute. I'll be back. Yeah, I'm so sorry for that. I had to attend it. Yes, all good now. So, ATCOM, we all know, has been included in the curriculum since 2019. And we may also call ATCOM as the heart and soul of medical education. Because it is not sufficient for a learner to be just proficient in skills and knowledge. To be a complete professional and to follow all the tenets and all the roles of an Indian medical graduate, we need to have that emotional part, that ethical part, that communication, robust communication skills for being a good professional doctor and to offer our service to the community in the best of manner. So the objective for today's session would be to sensitize to the ATCOM teaching module, which is given by NMC. And then we'll go through the ATCOM booklet and discuss the strategies which can be implemented for ATCOM during our teaching, and how can we take the assessments. All that we are going to discuss. And by the end of this session, we will be knowing what is ATCOM, what are the components of ATCOM, and what teaching learning methods can be employed and assessment. Fine. So the importance of ATCOM is that we all know that effective communication is the cornerstone of successful medical practice, isn't it? If we are a good communicator, we'll be able to break that gap and the bridge that joins the, we'll be able to build good relation with the patient, a good rapport with the patient. Then if we are a good communicator, we can extract information from the patient. We can then also we can provide emotional support during challenging times if we are good with our communication part. Also, if in a team we are able to communicate well, if there is proper communication, then we will be able to streamline patient care better, and that will definitely enhance treatment outcomes. It is also seen that if we communicate well to the patients, the compliance to the treatment is found better. And obviously, if the compliance is good, we can expect better treatment outcomes. So, obviously, communication is a much needed skill, and we need to hone our skills more and more during our medical education time in our undergraduate times only. So, initially, also, we used to get the training from our teachers, but then now just that it has been added as a former curriculum part of the curriculum, the student must be able to present some skills only to cross the barrier of the exam or to be through with the professionals. And this graduate medical education regulations has added it very specifically that for every clinical paper, all the papers should contain at least one question for ATCOM. So that only emphasizes the importance of ATCOM. Acha, there are times when we need to do decision making. There also, when we are faced with ethical dilemmas, when we have a background, when we have that knowledge, when we have been taught about the complex situations and how to navigate on those times, then this background knowledge and all that they have learned in their undergraduate times, that is going to help them navigate and come out better in these situations. And all this is going to build a positive attitude, which is equally important and crucial in the medical field. And the bottom line, which is most important, is if the quality of communication is good, it is also a major determinant of litigation and patient complaints against the care provider. Though we are emphasizing it all, but we need to inculcate more of communication skills and discuss it with our residents so that while they are doing the duties and they face situations, they are able to come out better in these situations. So we all know that being a doctor requires complex interplay of knowledge, clinical skills and acumen, communication, attitude, interprofessional behavior, and strong ethical values. So we need to shape medical professionals who are not only technically proficient, but also possess interpersonal skills. They are aware of the ethical issues and the laws associated, and they have built the right attitudes to deliver patient-centered care. So this ATCOM module, which has been given by NMC, it will serve as a foundation, and it serves as a foundation for developing compassionate, well-rounded healthcare providers who will do justice to their roles as clinician, leader, communicator, lifelong learner, and as a professional. So this is a glimpse of the ATCOM module that I've taken from the NMC site. All of you know that there's a module for ATCOM. We can download it from the NMC site for our perusal. Vision of this booklet was to develop professionally sound IMGs by undergoing training in attitude, ethics, and communication, and apply these trainings to provide effective medical care to the patient and responsible healthcare to the community. Before going further, I would like to read a quote from William Osler. The practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. So we need to put both our heart and our head into the practice of medicine. This slide just enumerates the role of an IMG, which is envisaged by the graduate medical education regulations. And initially it was just these 5, but now member of the healthcare team has also been added. So in these were the hidden curriculum, communicator and professional. Now it is formally a part of curriculum. All right. This is an excerpt which I've taken from the Graduate Medical Education GMER 2023, and I've taken this part which says that competency-based training program, which is meant for the IMGs, it would include designing and implementing medical education curriculum that focuses on the desired and observable ability in real life situations. So some of the competencies which are relevant to ATCOM, so for these I have added the competencies as a communicator and the ethical competencies which are expected from an Indian medical graduate. We can skip that. You can go and refer to the module and you'll find these competencies which are to be completed and before going through the graduate program. This is also from the Graduate Medical GMER 2023, which has been published. And the objectives of the program, this I will read, that at the end of the program, it should be the student, IMG Indian medical graduate, should be able to understand and apply principles of bioethics and law as they are relevant to the medical practice and research, understand and apply the principles of clinical reasoning as they apply to the care of patients, understand and apply the principles of system-based care as they relate to the care of the patient, understand and apply empathy and other human values, communicate effectively with patients, families, colleagues, and other healthcare professionals, understand the strengths and limitations of alternative systems of medicine. Now, these have been added. Initially, it was not present in the GMER 2019, but then the later version, which has come into 2023, all these have been added. Respond to events and issues in a professional, considerate, and humane fashion. Translate learning from the humanities in order to further his professional and personal growth. So ATCOM is a longitudinal program that will help students, longitudinal in the sense that it will continue in all the 4 phases, and many of the competencies, especially communication, is present in all the 4 phases. So that enhances the importance of communication, and it is a framework of competencies that students must achieve, and institutions can develop their own approaches to impart these competencies. Since all the participants here, we are all faculty members, so we'll discuss more on how we can go about with the ATCOM classes. This is also an excerpt from the GMER 2023, that it will be a longitudinal program spread across the curriculum continuum of the MBBS program, including internship. And learning experiences shall include small group discussions, patient case scenarios, workshops, seminars, role plays, etc. Attitude, ethics, and communication module developed by the erstwhile MCI should be used longitudinally for the purposes of instruction. This is the module that was given initially, and it is still valid and continuing. And 75% attendance in professional development program shall be mandatory for eligibility to appear for final exam in each professional year. So the strategies that can be employed for teaching communication skill, we can take classes and by the help of simulation and practice of specific skills in a safe and sheltered environment. And we can develop specific instructional strategies in safe environment, wherein we are not directly allowing the students to go and face the patients, and we are doing them in a simulated environment where they can practice communication, ethics, they can develop better attitude, which will help them in future when they face the patients. And the techniques that could be used are, apart from these discussions and small group discussions, we can use video clips, PowerPoints, role models, role plays, etc. to enhance our teaching. So in this way, these traits and these skills can be transferred to the patient, to the students. And finally, assessment is also an essential part of learning. Essential will also follow. Assessment will also follow. This in this teaching learning program that we teachers will have with the students. And ATCOM also needs regular assessment. So what do we do in all the terminals and all? Every time we keep a question from ATCOM so that uh, they are regularly answering questions on ATCOM as well, and they are in a habit of answering these questions, and they are well versed with these competencies. Now let us go through the ATCOM booklet and what all does it contain. So it's a structured manual which is a guide to facilitate institutions and faculty in implementing necessary competencies in attitude and communicational domains. It offers framework of competencies, and it also shows explicit ways of learning ATCOMs. It has also shown and it has explained various methods by which we can make teaching learning more fruitful for the students. The sections of ATCOM module are divided into three. First one is an extract from the GMER, and it is a base document which has all the competencies. So we don't need to go into that. The section 2 contains suggested teaching modules for each professional year. It is the most important thing that we need to go through. What all do we need to teach and how can we teach those? And the section 3 is a competency log that contains a list of skills that may be acquired prior to graduation. So it is divided into these three parts. And the section 4 is contains formative elements that are observable by the tutors or mentor, which is part of assessment also. So it is important that we may take help from the manual, but we can devise our own ways to for teaching learning for ATCOM sessions. We can plan our sessions tailor-made for our own needs and according to our students. Now, coming to the section 2, for the first phase or the first professional year, there are 5 modules, and the hours are total hours are 34. Of these, the one which is relevant for biochemistry, the one which is left, initially we had the independence that we could have shared the modules on our own will. But now it has been predefined that biochemistry is going to take module 1.1 and that two sub-competencies of this module 1.1. The first one is enumerate and describe the role of a physician in healthcare system. And the other one is describe and discuss the commitment to lifelong learning as an important part of physician growth. So there is also another sub competency of module 1.1, that is identify, discuss physician's role and responsibility to society in the community that he serves, which has been given to anatomy. All this together form module 1.1, which was what does it mean to be a doctor earlier. Now this has been, it has 4 sub competencies, and these 2 have been given to biochemistry. So what does it mean to be a doctor? It has 4 competencies addressed. These, the number 2 and number 3, these are for biochemistry now. And it is important to start the ideally while we were having a basic course, one observer said that we should start with the module 5 about the cadaver, but what the module says is you should start with the competencies, the basic ones, which will give you an idea, which will help them remember the bigger picture and remind them why they have chosen to be doctors. And it is good to start the discussion early about what are the roles of a physician, what course have they joined, and what is expected out of them. I'll skip this one. So the teaching learning methods that can be employed for teaching ATCOM are role modeling, interactive lecture, experience learning, reflections, and hybrid PBL discussions, role plays, videos, simulations. And the assessment methods are mostly SAQ, short answer questions. OSCE can be planned, and there can be workplace based assessment as well. This is a glimpse of all the competencies that are given in the 4 phases. We can see that communication is an important part in all the 4, which makes it a longitudinal learning. But we will focus on our module 1 only, which is about. So this is how longitudinally communication can be taken in all the 3 phases, like it was for module 1.4, then 2.1, and then 3.1, all about communication. And the learning goes in this fashion somehow. That's initially the students, when they come, they are in the phase of unconscious incompetence. They are unaware of the skill and the lack of proficiency. But they go step further, and then there is a phase of conscious incompetence, where they know, they are aware of the skill, but they are not yet proficient. Then comes conscious competence. They are able to use the skill, but they are not that fluent and fluid with the skill. And then there is a phase of conscious competence, when the learning has been achieved, imbibed, and now they are competent enough and they are good at performing the skill, and it becomes automatic for them. And the learning goes with receiving. That means the student will be able to show his awareness. Let's say in a case of a patient who's waiting for an OT, he's aware, he's receiving, he's hearing to the anxiety of the patient, whatever the patient is speaking, and the student is able to feel. Then the next stage is, it is an advanced stage, wherein the student will be able to reassure, to communicate, and to allay the anxiety of the patient with the help of his training. And then the better and the more equipped state is when the student is habitually, he is able to habitually comfort the patient with anxiety, and he is able to deal without an effort. So firstly, it is sensitization in the first one, which shows that we can present the idea to the student, we can make them explore, we can make them learn on their own also in the form of some STLs, self-directed learning. Then we can involve them in the process, and then they can think over what has gone, what all skills do they need to better themselves on, and what all do they need to learn, what have they experienced, and how is it going to help them. This will be reflection. So this is how the learning process goes. I have also added 2 examples of how we can plan a session for the students. Just one question, is this there's a block in my screen, are you also seeing that block? I mean, is it hindering your view? Never mind.
No, ma'am. We are seeing the full screen clearly.
Right. All right. Thank you. So the students can be divided into small groups, or else I'll give the examples later. We can talk about this. Yeah, this I would like to show that when we have to go for an ATCOM session, what can we do is we can introduce in the first class, we can go and introduce a case or a scenario of whatever topic which we are supposed to teach. Like for us, the two topics, the two modules, sub competencies that we have been assigned with, we can go and take a lecture or something on the topic, and we can create an awareness. And after that discussion, uh, we can break the ice with the students, some sort of introduction and group forming. And then after that, the second week will come. In the second week, in the first week only, in the first class, what can we do is we can form the groups, then we can offer them some study material, or we can ask them to collect some study material, and we can let them have some self-directed learning. And meanwhile, in the second week, we can have an anchoring lecture which will add on to whatever information we had given in the first instance. And then after this week 2, what will happen is in the next class we can take an introduction of the second topic, and after giving that, and although our groups are already formed, we can rearrange them or make some changes. And that class, the third week, it should come with the discussion and closure of case 1. Whatever groups we had formed earlier in our first week, we can ask them to either reflect or do some narration or other forms of discussion. And then after that discussion, the teacher, the faculty member can do a closure to the first topic, and similarly it will go on for the next one. So this was the teaching method which was suggested as the most effective one in the module. So this I wanted to mention specifically. Now I'll go to the examples again which I had added. So there is one scenario wherein the students, after that lecture has been given for an introduction, we can divide the students into small group, and each group is given a role playing scenario where they have to act as biochemists. Let us say we are from biochemistry, so we can give them a topic and we can ask them to become or play like a biochemist in a hospital setting who has been who is facing a ethical dilemma. Let us say it's a situation wherein some lab result include a potentially life-threatening condition. It may be some carcinoma or something, some cancer marker has come positive or anything of the sort. And the patient insists on keeping the information confidential and not sharing it with their family. So this is a dilemma, and we can have a long discussion on this with all the ethical issues and all the autonomy and everything. We can discuss the provisions and how we need to act and what will be the right way to act in such a dilemma. For these, we can prepare the groups by providing them with the necessary background information. We can give them the medical history so that they can do a bit of interpretation also, and also they know the relevant ethical guidelines or legal considerations that they should be aware of, and how will they practice it in future. Then we can also assign the roles to the group members, like somebody can become a biochemist, somebody will become a patient's family member, colleague, hospital administration. Then in a session we can have the role play. In the role play, we have to design it so that we can they can display more of communication strategies. We can they can come up with the ethical dimensions and also the decision making process while they are in the role. Then that can be followed by a discussion with the students, wherein after this activity the students come together, they will offer their impressions and their perspective and view. How do they see the situation and how they think that it should be ideal. And then we can discuss what is ethically and legally possible and how should we react in such a situation, or react is not the ideal word, how should we deal with such a situation. And then debriefing and feedback, then we can provide constructive feedback. And also this can be followed by reflective writing. For the students, they can write this in their logbooks, and this will help in making them learn about empathy, problem solving abilities, and also encourage collaboration. Similarly, there's another scenario where the topic is effective communication strategies in breaking bad news. This is not in module 1, but we can discuss a way how we can deal with the ATCOM class, how we can go about with the ATCOM classes, how we can conduct the classes for the best outcomes. In this, we can show a video. We can begin by introducing a topic and its relevance to biochemistry practice. Then we can emphasize effective communication on patient outcomes. अगर हमको किसी सा let us say if you have to ask a patient for a sample, then also we need to have communication skills कि भाई ये करके आना है आपको सुबह, या you have to come fasting, or you don't have to take your meals or water, or you take this urine sample in this jar. It should be midstream or early in the morning, whatever. All this includes and needs communication skills. Then the next thing is we can show them an interactive video. Interactive in the sense that we can show them a video that portrays a healthcare professional breaking bad news to a patient. We can pause them at the relevant points, at the key moments where we can discuss the communication techniques and how effective they are in both the good in the bad ways. We can show both the positive videos and the negative ones and how they affect the overall outcome. Then we can present real life case examples, something that we have experienced or our colleagues have experienced, and how they have come out of those challenging situations. All that we can discuss with the students. This will definitely equip them. We can also add some quiz questions to test the students' understanding of the principles or the concepts that we need that we are asking them to study or we expect them to learn. Then again, group discussion is always a good idea to let them learn. Then we can ask them to in a simulation to practice this and exercise this in similar situations. Then we can have reflection, summary, feedback. All these are going to convey our message in a interactive manner to the students, which they are more likely to imbibe, to absorb better, and to learn. This reflection, students come up with very interesting reflections. They write it on their own, and many a times we feel that this is a very good technique in which students come up with productive ideas. They narrate their experiences. Narrative writing is also one way of learning. So communication, I'll not go through much, although ATCOM includes communication, but communication is somehow out of our biochemistry part now. But some things which I would like to emphasize is we all know that communication has both verbal and not non-verbal components. And it is more often more important that we know how to say it than what to say. The same thing can be conveyed in many ways, and the outcome will depend very much on the way of delivery. And we should be very aware, and we should be very watchful of the non-verbal components of communication while dealing with the patients. This is something that we need to teach our students very specifically. And this is the time when we can also ask them about their clothing and timing and fluency, and how all this is going to affect their professional life, how this is going to make them a better professional. So that this ADCOM is not only something which is going to teach them competencies and equip them to become a better doctor with communication skills. Obviously, this is going to make them learn the way of life, how should they conduct themselves, how should they discipline themselves, and how fluency and uh, being aware of the timing. This in ATCOM only we can also tell them about the use of social media, and how this we have to maintain a line with the patients, and how this can be of good use and misuse. All this we can explain to them while we are in the ATCOM classes. I'll skip these. We can also discuss with them about the Kalamazoo consensus statement. All this will be more relevant when we are talking about the modules where communication is important. Communication, where we are discussing about communication. Now, something about self-directed learning. Self-directed learning, we can say that if you give someone a fish, you feed them for a day. If we just go and take a lecture, we will just that will be food for them for a day or for some time, or limited amount of information is going to go inside their head. But when they are going to search for the material, study it on their own with interest, and then we are going to come up and discuss it or present it in front of their peers, obviously the learning is going to be huge. So if you give someone a fish, you feed them for a day, and if you make someone learn how to fish, you feed them for a lifetime. So self-directed learning is very much like this. And self-directed learning, it is an important component of CBME curriculum, and similarly, likewise, it is important component of ATCOM as well. You just don't have to go and take the lectures all the time. Go and just kindle a spark, and then after that we should be facilitating more of self-directed learning. We can give them some objectives like you go and search for these, or you should learn about these topics or these aspects or these ethics, and then um, allow them to learn on their own. And after all this learning exercise, we should always discuss, and that will bring more fruits to SDL. This I discussed earlier. So something about this module that is in biochemistry. We can divide it. It is of 8 hours. So we can have an exploratory session for 1 hour. Then while we are making the group and having the ice breaking, and while we are facilitating SDL for them, we can have facilitated panel discussion for another 2 hours. Then they will have 2 hours of self-directed learning. Then we can also allow a visit to the hospital, or else we can take video classes, or else we can have role plays. All those will be equally helpful in conveying the message. And then we at last, in the last class, we can have a discussion and closure of the topic in 1 hour. So this is how it is the division for module 1.1. And this also I took from GMER only. So it also says about the exploratory session, in which we can ask why they chose to become doctors, what do they think are the privileges and responsibilities of the profession, so that when they have come here fresh, they know that what we expect from them, what the society is going to expect from them, what they themselves should expect from them, and what all they are supposed to develop in this time. Then we can have this facilitated panel discussion with doctors, and we can have interactions. Then we have to leave them for self-directed learning, where students can write their reflections after learning on their own from reading materials or any electronic relevant material that we can suggest, or they can find out on their own. We can discuss them later. We can also add an introductory visit to the hospital or community. Then we'll have the closure session. It is also mentioned in the module a white coat ceremony may be considered. So I think all of you are going have white coat ceremonies in your college.
तू मुझे डिस्टर्ब मत कर, मैं अपने साथ तेरा काम कर रही हूँ, तू अपना काम, जो तेरी गलती है, तेरे को पता, ओवर कॉन्फिडेंस है ना, सारा गलत करके आता है।
और तो
तेरे को पता फ्रैक्शन बनती कैसे, किसी
assessment
भी चीज के
part,
कितने पार्ट की।
for the assessment part, in the module 1.1, it is written that formative and summative assessment is not required. Not required, right? But nevertheless, we can assess them with the help of short answer questions or relevant OSCEs, or we can give them small quizzes also. Now, we'll discuss very briefly the assessment part, because it is not for the module 1.1, it is not that required, but then assessment is also a very important integral part of teaching learning. So assessment, because assessment drives learning, and we should be aware of the appropriate ways of assessment. This is also from GMER 2023, that we can take written tests of ATCOM by short answer questions. We can ask them for creative writing or narrative writing experiences. Then we can take OSCEs and Viva Voce, and at least one question in each paper of each clinical specialty in the university exam shall test knowledge competencies acquired during the professional development program. And these skill competencies must also be tested. I'll reiterate it again, that assessment should be valid, reliable, relevant, then feasible, observable, and measurable. It should be learner-centered, linked to learning outcomes, and linked to performances of understanding or active learning methods. This shows the pyramid. This shows the knowledge part, and then application shows how competence. And this is all for cognitive. And for the affective domain, we can test by the help of simulated situations, wherein we can ask them to communicate or act or show their skills Similarly, in OSCEs, or we can take a Likert scale, a questionnaire. Semantic differential scales are scales where some skills can be tested by two ends of a state, like good or bad, or somewhere in between. This is how the scale goes. Then after that, in the page in the logbook, we need to mention the name of the module, the ATCOM competency addressed, and the knowledge part, and reflection. Reflection, as we all know, it is written under 3 headings, so I'm not going to discuss those. And this is an example. Like for first professional, let us say if it is module 3, doctor-patient relationship, then the competencies are these. These can be written, enumerate and describe. And then it is in the knowledge part of the module, and then in reflection, what all can be written. Another way in which assessment formative one can be done is narrative writing. Narrative writing का एक example I'll show. This was written by an MBBS student, a day in the life of a postgraduate on COVID duty. So this is a bit elaborate as compared to reflective writing. Reflective writing is under 3 heads, but narrative writing is about a bit more elaborate with the experience part, emotional part, and their experience. So this is narrative writing. So we can encourage students to for narrative writing as well. This creative writing will help them develop writing skills, communication skills, to express themselves, and also how to deal with the team. All this will be inculcated with the help of narrative writing as well. So that is all from my side. We can summary is successful educational interventions require multi-pronged strategies, including building up knowledge, demonstration, feedback, reflection, self-assessment, repeated practice in safe and simulated environment. Thank you.
Thank you, Dr.
Dr.
Sufia.
Sophia.
Thank you, Dr. Sufia. And I would like to invite Dr. Harjeet Singh sir, HOD SMS for
Good
vote of
evening, everyone.
thanks.
Good evening, everyone. Dr. Sufia,
Good evening, sir.
good evening. Uh, Thank you for presenting this nice and informative um, slides. And thank you to all of the participants. Anita, continue.
I would like to thank you for the opportunity, sir. It is nice to come and interact with you all and participate in this learning session.
Thank you, all of you. Thank you, all of you.
I would like to thank Dr. Barar sir also for his cooperation.
Welcome, ma'am. Anytime. Always a pleasure to be of assistance.
And
Yes.
I would like to thank all the participants for patient listening. Any questions from participant side?
Thank you, Dr. Anita Verma, for organizing this session. Hello. Hello. Dr. Anita, can you hear me?
Yes, sir, you are audible.
Okay, thank you, Barar, Vijay.
Good evening,
Dr.
sir. Thank you.
Thank you to all, and I think we should, if there is no question, we can leave this. We can end with this.
I think we can leave, sir.
Thank you all.
Thank you again. Thank you.